Josh Weaver, and I'm one of the physical therapists here at Solid Rock Physical Therapy and Wellness. This is my wife, Kristen. She's also a physical therapist here. If you're watching this video, it's because you were interested in learning how to do the chin tuck exercise, also known as cervical retraction, as one of the postural exercises that we described in the blog. And so Kristen is going to demonstrate the exercise, and I'm going to go over a couple of details that will be important if you would like to do this exercise. So first thing we talked about in the blog is making sure that three anatomical points are in good alignment. And the first reference point would be the hip bone, which for Kristen is right about here. And we want these three anatomical locations to line up as best as possible. It's very difficult if you have tightness in your upper back, in the upper neck, even in the lumbar spine. But today we're going to focus on the hip bone here and trying to get that to line up with the shoulders, which commonly you're going to have to bring the shoulders back just a little, kind of squeeze those muscles in the back here just between the shoulder blades just a little bit. And then the third landmark is the opening of the ear, the external auditory meatus. And you want to try to slide your head back to get that opening to line up with the shoulders, and shoulders to line up with the hip bone there. And if you can achieve that without feeling a lot of tightness here and here, then this exercise may not be necessary for you. But if you try to sit in this position and you find that it's really difficult because of some tightness in these areas, this chin tuck could be very valuable for you and ultimately helping you achieve this posture. So, Kristen, go ahead and just kind of fall out of good posture for a moment. And you can see that when the head comes in front of the shoulders and the spine here, that it's out of balance. Now, her muscles back here happen to actually work harder to keep her head from ultimately just doing that. And instead, when she gets in that good posture, that gets her head centered over her spine, putting it in a better position of balance so that her muscles don't have to work as hard. Okay, so the chin tuck. The idea here, and I talked about it in the blog, is you want to imagine that your head is on a shelf, which is kind of morbid, but I think it's helpful because the motion that you're going to try to achieve is to actually slide the head back on the shelf like that, as if you were pushing a trophy back on the shelf or something. You don't want it to roll back on the shelf. That would be incorrect. Again, so it's a sliding back, and this position here is a combination of movements within the joints of the neck and the head and the upper back. And so that's why when you're tight, it's really easy to take the path of least resistance, which would be to slightly tilt your head back, okay? Now, to help facilitate this, sometimes it's useful to actually use the space between your thumb and your index finger and just put it on your chin like that. And then imagine that you're pushing your head back on that shelf, trying to keep your nose and your mouth down as you push, and then relax. And you would do repetitions at about this speed, hold for about 1 second, and perform about 10 repetitions. Now, as Kristen's demonstrating some of those, a couple pointers. You don't want to get over aggressive with this one. You don't want to just crank on it and think, the harder I push, the faster I'll get my posture back. These structures that have tightened up, they've likely tightened up over a long period of time. And so it's important to be careful with this and just get a gentle stretch. These structures will start to loosen up over time, making it easier and easier to get into that position and get a better balance with your head over your shoulders and start knocking out headaches, neck pain, and any other number of issues, minor issues that can accompany a forward head posture. So appreciate you watching. We're going to be demonstrating a couple more exercises that will help to loosen up the thoracic spine here, or the upper back, and then another exercise to really help, it's really more of a stretch actually, to help loosen up the muscles in the front here, the pectoralis muscles, which will pull your shoulders forward. So these 3 little exercises will hopefully be helpful to you in getting a better posture and keep pain at the curb.